Hello and welcome to this press conference. Bonjour et bienvenue à cette conférence de presse. I'm Elizabeth Thompson with CBC News. With us today, we have the Honorable Marci Ien, Minister for Women and Gender Equity, Equality and Youth, Farah Khan, Action Canada for Sexual Health and Rights, and Wendy Norman from the UBC Contraception and Abortion Research Team. They will be talking about an announcement on funding for projects to help strengthen abortion across Canada. Il va faire une annonce sur les fonds pour les projets d'aider l'accès à l'avortement à travers le pays. Ms. Ian?
Merci beaucoup, Elizabeth. Hello, everyone. Thank you so much for being with us this morning. Bonjour, tout le monde. I'd like to begin by acknowledging that the land on which we are meeting is the traditional unceded territory of the Algonquin Anishinaabe people. I am honored to be here with Farah Khan from Action Canada and Wendy Norman from the University of British Columbia to speak to Canadians about why we need to continue doing absolutely everything we can to make sure that women have access to safe and consistent sexual and reproductive health care, because reproductive health care is health care. But we know that access isn't consistent across the country, and not everyone has the same level of access. We also know, even though healthcare is a responsibility of the provinces, we need to do everything that we can from a federal level to fill in these gaps. These gaps aren't often mentioned, and we don't hear about the women. We don't often hear about their stories, the women that are impacted by this lack of access. But we're here today because of women like Anna, who was helped by Access Canada. Anna is a single mom of three. She lives in a community north of Winnipeg. She works two service jobs, including one that has overnight shifts to provide for her children, and relies on her family to take care of her kids while she works. Anna realized that she was pregnant and she knew that she couldn't continue this pregnancy. By the time she got connected to the right medical professionals and could make it to her dating ultrasound, she was too late in her pregnancy to get an abortion in Manitoba and was forced to travel to Ontario for her appointment, risking losing her job and having to leave her three kids behind while recovering in another province. We're here today because of young women like Lori, 17 years old, living in Newfoundland and Labrador, rural Newfoundland and Labrador. Lori is estranged from her family and lives with her grandmother. She calls a few places, but by the time she finds a clinic in St. John's, she realizes she doesn't have enough money to get there. So she ends up calling a program that can pay for all the travel costs, and they arrange for her grandmother to accompany her. The clinic offers her birth control options, and she's able to leave with an IUD after a doctor helps her choose the right contraception for herself. These women's stories are vitally important. Why? Because far too often we forget that the decision to undergo an abortion is not a simple yes, it is not a simple no. It is a combination of many, many factors, such as where someone lives, what their cultural background is, their job situation, the family supports they have or don't have, their age. And when we combine that with the intersectional experiences of Black, Indigenous, racialized, 2S LGBTQI plus outcomes, well, those outcomes are even harsher. That is why we created the Sexual Reproductive Health Fund to support a wide range of evidence informed and innovative projects that address the pressing needs of people in Canada who are at increased risk for poor sexual and reproductive health outcomes. To date, the Sexual Reproductive Health Fund has provided $38.9 million in support. That's out of a $45 million commitment thus far, to support community organizations working to improve access to sexual and reproductive health care. And this includes $8 million to improve access to abortion services. Almost a year ago, to this day, Minister Duclos and I announced the first project supported by Health Canada's Sexual and Reproductive Health Fund. These projects focused on access to abortion. It is beyond fitting for Farah to be here today because Action Canada's initial project was one of the first projects announced along with a project led by National Abortion Federation of Canada. So to today. On behalf of Minister Duclos, I am so pleased to announce more than $4.2 million in funding to the University of British Columbia Contraception Abortion Research Team, also known as CART, and Action Canada for Sexual Health and Rights for two really important projects. Through Health Canada's Sexual and Reproductive Health Fund, it will improve access by removing barriers to vital abortion services and offer accurate, and I want to press on that point, accurate reproductive health information to Canadians. Action Canada for Sexual Health and Rights is receiving $428,236 in funding to expand its access line and sexual health information hub programs. Those stories that I shared today, Anna and Lori's, are young women who were able to access that care, who reached out. That's where we got those stories from. The expansion will help increase the project's reach and accessibility for underserved populations. This builds on last year's investment of just under $2.3 million. With last year's investment, Action Canada's access line fielded over 5,200 calls. That is a 70% increase from the previous year. It supported 167% more people through its emergency fund. These are real people. And it provided 225% more in financial support for travel and for logistics. They're also advertising the access line in communities where anti-abortion activities are rampant, as individuals in these communities are more likely to be given misleading or non-factual information. And Action Canada began the work of reviewing and revising and expanding the content available online through its Sexual Health Hub to ensure that it meets the needs of underserved populations, the populations I've outlined today. Thank you, Farah, for this really important work, life-saving work. UBC CART and Wendy is receiving close to $4 million in funding to address the abortion information, access, and appropriate care needs of key underserved groups. These groups include people who are Indigenous, racialized, migrants, homeless, or underhoused. To us LGBTQI+ youth and those with disabilities and/or complex health concerns in Canada. CART is collaborating with more than 15 other partners in this important work. This project will create resources for healthcare providers and patients that will be widely available through a virtual community of practice platform. They are providing additional educational material in multiple languages, and that's really important because people have to understand what is happening and have to be related to in the language that they're comfortable in speaking. So material in multiple languages, and CART will be hosting a summit of learning and bringing together various experts. Thank you, Wendy, for your amazing leadership on all of this. These investments reflect on our belief that women and women alone have the right to make decisions about their own bodies, and that no matter who you are and where you live, we will always protect sexual and reproductive health rights for all individuals in Canada. And for many years, both UBC CART, Action Canada, and so many other organizations across our country have been working to improve access. Make no mistake, we know that there is still work to be done, that there is still a long road ahead, but the Government of Canada will continue to work alongside you and support you in your efforts. To close, in Canada, sexual and reproductive rights are human rights. Period. Plain and simple. Thank you. Merci beaucoup. Passing the mic over to Wendy now to say a few words. Wendy Norman.
Merci, Minister Ien. Uh, that was very inspiring. Thank you. I wanted to start to say that I am also honored today to speak from the lands of the Algonquin people. And further, I wanted to acknowledge the lands where I live, work, and play as an uninvited white settler in the ancestral unceded territories of the Musqueam, Squamish, and Tsleil-Waututh Nations. Je suis ravie d'être ici aujourd'hui pour recevoir ces financements au nom de l'Université de Colombie-Britannique et de notre recherche nationale de planification familiale, les Contraception and Abortion Research Team, groupe de recherche sur l'avortement et la contraception. We are a multidisciplinary pan-Canadian research network of academics, clinicians, trainees, health policy system and service decision makers, and community organizations. We share a commitment to conduct impactful research that asks and answers these important questions that Minister Ien has been outlining. We want to improve equitable access to the knowledge, methods, and services that women and people throughout Canada need to realize their own goals for whether and when to have children. We are thrilled to introduce our CART Access project, advancing access to abortion for underserved populations through tools for healthcare professionals and people seeking care. Further, as the Public Health Agency of Canada and CHCH chair in family planning applied public health research, I have been uniquely positioned to be present to and impressed with the range of highly impactful, sweeping policy changes led by this government. I fully recognize Minister Ian's need to present where we have cracks, and this is where the project and the funding today will make such a difference to make an impact. Equally, this government has made more advance to improve sexual and reproductive health and rights for people throughout Canada and their access in this past decade than we've seen in many decades before. Health Canada recently modernized their whole policy on how to approve contraceptions, which has led to approval of a much wider range of contraceptive choices, including new options for long-acting reversible contraception, such as subdermal implants, other intrauterine contraceptives, as well as a whole range of new oral methods. This supports, much as Minister Ien mentioned as well, that women and people across Canada can choose the method that fits in their own context and that answers the needs that they have. Statistics Canada is instituting Canada's first national sexual health survey. This will, for the first time, measure the important factors related to why people have unintended pregnancies. This is a key first step to target our policies and services so that we can equitably assist people to time and space their pregnancies. And it's a highly effective strategy to reduce the number of those with difficulty to access abortion services by working in a preventive nature upstream. Since 2016, Health Canada's approaches to regulate the abortion pill mifepristone have demonstrated global leadership. Their evidence-based drug regulation. The prescription now can be provided in Canada by any authorized prescriber and dispensed by any pharmacist. This regulatory approach has already more than tripled the number of healthcare providers providing abortion services in Canada. Now, for the first time in history, Canada boasts a higher proportion of health professionals providing abortion in our rural areas per population than in our urban areas. This policy has ensured abortion services across Canada are closer to home than ever before. Further, in my role as interim executive director for UBC Centre for Gender and Sexual Health Equity, I'm grateful to Minister Ien and her group for over $2 million in funding that have helped us look at gender equity and access to responsive justice among some of our most underserved, marginalized, and criminalized populations, and best practices for trauma-informed care for those who have had the misfortune to be exposed as their early childhood experiences. We will hear from Action Canada about the progress to date for the initial projects funded through the Sexual and Reproductive Health Fund. And I wanted to talk a little bit about our plans for this funding announced today for the UBC CART Access Project, which will build on all of this process to ensure our country takes these next logical steps to address those gaps that Ian had referred to, affirming the appropriate abortion care for those most in need, those underserved groups. UBC and our CART network are honored to work with key national health professional, advocacy, professional educator groups across the country to create and implement this important project. I'd like to recognize the Canadian Pharmacists Association, the Canadian Association of Schools of Nursing, Canadian Association of Midwives, Society of Obstetrician Gynecologists, College of Family Physicians Canada, of course, Action Canada, and also the National Health Abortion Federation, as well as health professional regulators and many others joining into this project. Building on these partnerships with organizations across the country, our team includes experts from 8 universities, projects at 4 leading women's health teaching hospitals, and engagement with health professionals in every province and territory. Further, our International Advisory Council includes experts ranging from Sweden's Karolinska Institute to leading abortion service innovators in Australia, Scotland, UK, and importantly, last and definitely not least, people across the country who self-identify as being members of these underserved groups are engaged throughout our process and will be advising and guiding all of the aspects, ensuring we're best positioned to advance services and resources that will be contextually appropriate, that will be accessible, that will welcome and affirm all people. 10 of our partners lead sub-projects interconnected within the umbrella of this CART Access project. Each will address a key identified service need or patient resource gap, as well as the central initiatives outlined by Minister Ien. One of our projects will bring a network together of the leading women's health hospitals across the country to provide mentorship hubs for all abortion providers of any health discipline who are new to care and need that real-time support of an expert at their fingertips. We're also, as we mentioned, working with a number of patient groups. And one of the unique pieces I'd love to tell you about is a lab run out of the University of Toronto Department of Social Work, where they have a research team led by youth and a range of those who self-identify in many of these groups: homelessness, marginalized, those who have been recent immigrants, who have been involved with the criminal justice system, who are working as the leaders for a research lab. And this lab will be holding seminars with the different health professions to discuss with them and push them on how they can best meet the needs that the youth identify themselves from the Youth Wellness Lab. Further, our Health Professional Association leads will each be creating a host of health professional training resources to advance the abilities of nurses, midwives, pharmacists, physicians, social workers, and uniquely through a University of New Brunswick-led project, abortion doulas, that will help to address some of these gaps in care. All of these aspects aim to support safe, accessible abortion that reaches out to our underserved people. All our projects work together. All aim to narrow the gap between a person seeking abortion and equitable, appropriate, affirming, high-quality abortion care closer to home. On behalf of UBC and CART, we are incredibly grateful to the Government of Canada and the Sexual and Reproductive Health Fund initiative for this funding. We are excited to begin these important next steps. We share the commitment to improve equitable access to the knowledge, methods, and services that people throughout Canada need to realize their own goals for whether and when to have.
Now passing the mic Safara, so glad you're here.
Hi, everyone. My name is Farah Khan. I'm the Executive Director of Action Canada. I too am a visitor on Algonquin territory right now. I come from Treaty 13. Action Canada for Sexual Health and Rights is a progressive, charitable organization committed to sexual and reproductive rights, health in Canada and globally. We're building on 50-year legacy of organizations that formed Action Canada. We work to promote health, equity, well-being, and human rights related to sexuality and reproductive care. And I just have to say, I'm really excited to be on the stage with two amazing feminists to talk about some of my favorite things, which is reproductive rights and sexual rights. What a moment right now to think about. The Health Canada Sexual and Reproductive Health Fund is an historic investment in making sure people across Canada have access to sexual and reproductive health care they need. Action Canada is proud to receive the funding that was announced today through this fund for their Access for All program. This investment of the Government of Canada, under the leadership of Minister Duclos and Marci Ien, Minister Ien, will ensure that Action Canada has capacity to continue and expand our toll-free access line and address barriers to abortion access across the country. Our access line, the Action Canada Access Line, is a toll-free pregnancy information and referral service paired with a national abortion financial aid program called the Norman Scarborough Emergency Fund. 1 year ago, we received funding as a part of the Sexual and Reproductive Health Fund so we could grow our ability to meet the needs of people in Canada who need to access abortion. Today, I can tell you in a short year that we have seen a 70% increase of calls for our phone line. We've almost tripled the number of people that we're supporting with their appointments. The impact of this funding was immediate and profound in the lives of many people, people seeking support. These aren't just numbers, these are people in our communities, our friends, our family members, our children. And now we get to continue doing this work because of the amazing funding. The stories that you heard, Anna's and Lori's, are stories that we hear on the Access Line every day. They inform our work and towards meaningful and long-term change to increase access to abortion. They are front and center, and we make sure that we listen to people in the community. We listen to hospital administrators, community partners, and policymakers as well. The work to expanding abortion is important for every community. And at its core, we're so happy to be a part of a team of people across this country that are doing this work, including Dr. Wendy Norman. Thank you so much for your work with CART that is increasing access across. I feel like I'm beside a superstar in this moment, as we are. CART has done exceptional work to ensure that there's access to abortion in Canada and to ensure that we have contraceptive access as well. It's an honor to work in partnership for structural change with you. We also are so grateful for the partnership of our colleagues at the National Abortion Federation of Canada, with whom we work tirelessly to connect people with care day in and day out. In Canada, 1 person in 3 who can get pregnant will have an abortion in their lifetime. I'm going to say that again. In Canada, 1 person in 3 who can get pregnant will have an abortion in their lifetime. People we know, people we love, people we care about, deserve and have the right to access abortion. And yet, abortion is not always within reach. While the right to abortion is guaranteed in Canada, not everyone has access. Abortion services are mostly found in big cities. For some people in Canada, they can access abortion right or down the street. For others, it's not so easy. And we heard that with the stories of Anna and Lori. We hear that in the access line every day. We hear them from hundreds of people who lack access in their communities and have to travel sometimes hundreds of kilometers to get an abortion. They have to pay out of pocket for bus tickets, plane tickets, gas, hotel rooms, and more to ensure that they can make it to the hospital or clinic. They're traveling from another city for a procedure that can also mean having to take time off work, plan and pay for childcare, elder care, pet care, and food for the trip. It is not a simple task. Not everyone can afford the expenses. And for some, this can lead to having a delay in the procedure to raise the necessary funds. Can you imagine having to raise the necessary funds for something that should be a right. What's more, delaying an appointment can mean over a gestational limit in your province, and then having travel even further with even more expenses. In Nova Scotia, for example, where there are no service beyond 16 weeks, past that limit, you need to travel to Montreal to get an abortion. If you can't be seen there, you have to book in Ontario. And if wait times are too long in Ontario, you have to go to British Columbia. That is why the Action Canada Access Line and this funding from the Government of Canada is so important. People call us for lots of reasons. In some cases, they're afraid to ask their family for help. They're afraid to talk to their family doctor. They don't have a doctor, or they simply aren't sure where to turn. We help fill out the right paperwork, get in touch with the right providers, locate services, find licensed childcare, enlist the help of doulas, and on and on and on. That is why Anna and Lori got the support they needed, because the staff on our access line do the work day in and day out to ensure that people can get access to abortion. Our emergency fund, meanwhile, pays for travel, but also meals, childcare, disposable cell phones, and other essentials to get to an appointment. The people we support are young and old. They are parents, child-free by choice, or planning families later in their future. They are moms who are here to help their daughters, partners whose credit card is maxed out, social workers whose clients need urgent support. They're in relationships that are nourishing, or they're not in relationships at all. They're in abusive ones. They've been sexually assaulted, or their contraception has failed. They are the people in our community. They are sometimes struggling with addiction or mental illness. They're supporting their families. They're on work visas. They just lost their job. They're in school or have been told they would never get pregnant because of their health. They are people that we care about. Every story is unique, but one thing is true. This is the reality of abortion. Real people with real lives know that what's best for them and know what it means if they can't get to their appointment. That's why it's so important that we increase access. What is also real is not everyone is impacted by barriers in the same way, but Minister Ien has named that Black, Indigenous, racialized people, poor, low income, people in remote and rural areas have great trouble getting access to abortion. That's why we need to eliminate those barriers. And speaking specifically about people in rural and remote communities, those in northern parts of the provinces, many people are struggling with how they get access to this. People who don't speak English or French, people who have access to the internet, people we leave behind by not providing adequate support. And that's why our phone line is so important. And that's why the Sexual and Reproduction Fund is so important from the Government of Canada. I feel like today is a celebration. Today is a celebration about access and about abortion and about the care that can be provided when the funding is there. I want to thank the Government of Canada for making this possible. Allow us to expand on the critical work to ensure abortion access for all.
Thank you. Now it's time for questions. C'est le moment pour les questions. If you would like to ask a question, please raise your hand. Okay, Catherine Cullen, CBC.
Hi there, Minister. I was just across the street. Conservative MP Kathy Wagentall is having had a news conference about her bill about violence against pregnant women. She began by saying that she can't help but notice that when she calls a news conference, there seems to be a Liberal news conference that is around abortion, and she implored the Liberals not to use this as a wedge issue, the issue of abortion as a wedge issue. What would you say to that?
The issue of abortion will never be a wedge issue. We heard the numbers. Yeah, like 1 in 3 people who get pregnant will have an abortion. This is not hypothetical. And this is something that our government has never, ever, ever wavered on. This isn't new. This is something we've been consistent on because access to abortion is healthcare. We are talking about women's rights. We are talking about human rights. We'll never waver on that. 1 year ago, I was here with Minister Duclos announcing funding, of which Farah's organization was part of. This is 1 year later. We understand this bill is there. We've seen this before. I look forward to the debate in the House. But this is about 1 in 3 people who can get pregnant will have an abortion in their lifetime, and making sure that when they have to call, if they're in a rural area and they don't have the transportation they need or the money they need to get access to care, that they can call a crisis line and there is somebody on the other end that speaks the language that they speak, can provide the travel, can provide the comfort, can provide the information they need. That's what this is about.
In addition, she talked about this private member's bill that she has put forward, and she made quite a point about saying she does not consider this issue about violence to pregnant women to be in any way about the discussion around abortion. I wonder if you have, as the minister responsible for women and gender equality,
Mhm.
thought about whether or not you're going to support this piece of legislation.
I look forward to the debate in the House, very much forward to the debate in the House. But I will say that we are not a government that will trick people into places that would limit the access to women across our great country to get an abortion. That will never happen under our watch. We've seen this before. And again, I look forward to the debate.
Or Osmond, or Valerie, Michaela, Jane.
So are you feeling like this bill is an attempt to open a door that's been closed?
That is something that we've seen before. And again, looking forward to the debate, but it's something we've seen before. And it's something that our government will always um, recognize. And I will reiterate what I've said. We will always stand on the side of women in this country for access to abortion. We are here with 2 organizations today who have clearly outlined who is accessing and why they're accessing, and understanding that this impacts 1 in 3 people who can get pregnant. That's a heck of a lot of people. And as Farah pointed out, these are real people with real lives and real stories who are scared, who are in different situations, and we're always going to be there for them. This fund provides monies to grassroots organizations on the ground who are dealing with the very potent reality that people need help. We are not living in silos. We've heard the urban numbers, we've heard the rural numbers, and they're there. We are talking about $45 million over 3 years. Budget 2023 renewed this with an additional $36 million over 3 years because our government knows how important this is. And we will always stand up for women and access to abortion in this country.
Not saying that she wouldn't be doing this if the MP Wagenthal came up with her bill today, but is this also a way to, for lack of a better, but retaliate is not the right word, pardon my French, English is my third language, but is this a way to stand up to any bill, any idea that's going to be put forward that's going to open the door to discuss abortion in Canada?
We've been consistent. We've been standing up all along. As I said a year ago, it was my honor to sit here beside Minister Duclos as we made an announcement and provided monies for the Sexual and Reproductive Health Fund, of which Farah's organization was a recipient. This is something that we have been consistent on and will continue to be consistent on. This isn't new. We have stood and will continue to stand.
I mean, I understand it's not new, but what I'm trying to say is this also an approach to say that whenever someone is going to bring forward ideas of talking about abortion, saying that we shouldn't allow access, or whether it's frontal or not discussing abortion, you're going to be there with an announcement or taking over the conversation to bring the attention to something else?
I don't know about taking over the conversation, but I know that this is something that Canadians care about a lot. We see the disaggregated data. We see who the underserved populations are. And again, our government will never shy away from standing up ever for women. And so that's why we're here. It's, I liken it to something else that happened 3 years ago, and that's the killing of George Floyd. Two very, very different things. But at that time, we heard a lot about the states and look at what happened over there. And then a year ago, Roe v. Wade was overturned. And it was, look at what's happening over there. The fact of the matter is, these things are happening here. And we always have to stand. We have to be relentless in standing up for rights. And as I've said, women's rights, reproductive health care are human rights. And we have to understand that if they would ever be threatened, and we saw what happened in the States, and we see what's happening here, we will always stand.
Laura Osmond, Canadian Press.
My question is for Farah and Wendy. I'm just wondering, aside from these funding agreements, what could the federal government be doing at a systemic level to improve access to abortion in Canada?
Thank you very much. This is a phenomenal question, and I think one that's really important for us. As we know in Canada, healthcare is delivered by the provinces, and we have the Canada Health Act that ensures that all of the provinces are providing abortion care. I think one of the pieces we really need to look at is supporting people to be able to move through their reproductive lives in the safest, healthiest way possible. And I think there's a lot of room in Canada to be able to support people with knowledge, methods, and services upstream of needing an abortion in terms of the prevention of unintended pregnancy. And we've never before counted unintended pregnancy or looked at the disaggregated data to find out where it's happening or to whom it's being experienced. And we have then been hamstrung we, to be able to address the needs of people to proactively prevent unintended pregnancy. This new survey, and I know Minister Ien's team have been key in moving this forward, that will be distributed by Statistics Canada, will for the first time give us that kind of data. And then both federally and provincially, we have the ability to model policies, to make system decisions, to target services so that we can best meet people's needs across the country. One of the best ways to make sure that the fewest possible people have difficulty accessing abortion services is to help people prevent unintended pregnancy. And that looks at knowledge, at methods, at services, all of which are benefiting through the actions of the Sexual Health and Reproductive Fund the government's bringing forward, and many of the actions led through the Ministry of.
Um, I think obviously for us would to make this fund permanent. Now, I think it's an amazing investment that's happened and it continues to happen in the last budget. And I hope with the work that we're doing, you see the benefits and we continue to fund this. And that's what we're really hope to. I think there's lots of work that being done around midwives being able to be a part of abortion services. That's one thing that we could work with the federal and provincial governments on. I think another piece is around access to information. I know Minister Ien is doing exceptional work around gender-based violence. And a part of addressing that is also people understanding sexual health and rights and making sure that that's a part of the conversation, that both of those things come together. Because so many young people don't know or understand their sexual health needs because we have a lack of comprehensive sexual health education in Canada in schools. And so, how do we increase people's knowledge around that? We want to address sexual and reproductive rights. A part of that is knowing how your body works and understanding how contraceptive works. That's a big piece of this too, demystifying. And another piece for us too is making sure that everyone can access abortion. So making sure that people that are migrants can also access abortion and not have, they can, but the cost of it is so high. Right? So making sure that everyone.
Thank you. I'm wondering if there are policy levers the government can use to improve that access that you're talking about. For example, holding the provincial governments to greater account through the Canada Health Act, including abortion in the renegotiated bilateral agreements as part of the new healthcare deal.
If I might, if I might, um, that's clearly under Minister Duclos' purview, but I can pick up on the action plan to end gender-based violence and the fact that we are working in partnership with provinces and territories. And that is the basis for the plan, that each province knows what it needs. Each territory knows what it needs, and they're all different. So, to far as example, Ontario, for example, might highlight human trafficking. They might highlight sexual and reproductive health. And if they do, then the monies that come from us federally will go to them, and that's where they will put it. It might be different in Manitoba, it might be different in Nunavut. But that is why the action plan to end gender based violence is so important. That $500 million that says to provinces and territories, we are here to help in partnership with you. Let us know what you need. Talk to the grassroots organizations, work in concert with them, and we will help to fund. And so part of the things, some of the things that Farah's talking about here might very well be part of what we see when we hopefully roll this out. Negotiations are ongoing right now. We intend to meet with provinces and territories in the summer and get this hammered out.
And will rural abortion services be part of that strategy?
Rural abortion services is something that is under the purview of Minister Duclos and Health, and I will continue to support him on that.
Any other questions? Yes, Stephanie Levitz, Toronto Star.
My question's for the minister. What happened to your promise to remove charitable status from crisis pregnancy centers?
Nothing happened to it. It is very much still there. It is under the purview of the Minister of Finance. The bottom line here is choice. It is the basis for everything. And I really have to distill it down to that. Choice meaning you can do what you need to do, but have the respect and know that I should be able to do that too. It's choice. And um, if that choice isn't provided, that is still a lever. And I can get you more information on that or put you in touch with those in the minister's office, but it's still very much there. It hasn't gone away.
I guess just as a follow-up, you keep insinuating something is happening here. What is the something that is happening here that you liken to what's happening in the United States with Roe versus Wade? What is the risk you actually see active here that is like Roe versus Wade, which is what you exactly pointed to as your example?
Mhm. I pointed to that example because it's the whole idea or the reality of um, understanding that women's rights are always threatened. Um, As a former journalist, I sat and looked at and watched journalists report on what was happening in the States, not understanding that we had similar threats here in this country. When you only need to look at marches that happen, um, the mail and emails that I'm deluged with, not just ministerial, uh, but constituency based. I represent Toronto Centre. So I only need to look outside. I only need to open my inbox to know that our rights, these rights are under siege, and that these things start sometimes in an insidious way. They're quiet, they sneak up, and all of a sudden, they're here. And this government has always been unwavering when it comes to this. This government will always stand. It is one of the reasons I ran. to use my voice and echo the voices of, of my colleagues that we will not stand for anything less when it comes to this issue. Many others too, but this issue.
Any other questions? Y a-t-il d'autres questions? One last question. Michaela?
Fi-
Valerie?
It's fine. So you've mentioned that in the last a couple of years, I guess you've, or maybe what last year you've helped 70% more people. With that money, is there anything specific you'll be able to do more of specifically? You've gone into details of what you've been doing, but wanted to know what it's going to change.
With the funding that we received, we were able to hire more navigators, so people that system navigators to support people who are calling our phone line. With a 70% increase, it means not one person is fielding all those calls. It means we were able to get more people that were trained to do that support and make sure also that we can support also the more callers that we're getting. You know, we are seeing more people call, which means more support needs. So people needing support from transportation to childcare support. I think people forget that mothers have abortions too. You know, Mother's Day is coming up, and the conversation sometimes is like either you had an abortion or you're a mother, and it's like no, mothers have abortions too. So providing support to moms that are trying to support their two kids that they have, getting childcare for them, making sure that they have the support that they need to be able to go to their appointment. With the increased funding, also, we're able to actually give time to think about, okay, the sexual health hub, which is really important to give evidence based information to people about their sexual health, which is really important. You know, we're seeing a dearth of misinformation being shared online, and, things go viral really quickly that sometimes aren't accurate. And so making sure that information is there. And same with the phone line, making sure that people have information that is evidence based, accurate, and trauma informed.
Thank you very much. Merci beaucoup.